Hello, I'm Dr. Charlene Azad, an internationally trained medical graduate and a master's student at McGill University. Today I would like to talk about the role of a communicator. That's an essential, intrinsic role in the CanMeds framework. So what is a communicator? A communicator is a person or a physician who builds a relationship with a patient and their families, and also connects with them and partakes in the gathering and sharing of health information to provide effective health care. Why is it that the CanMeds framework highlighted this particular role or skill, even though sometimes we might think it's something that comes naturally? It's to ensure that all physicians are competent. So what is a communicator? So the CanMeds framework defines a communicator as a physician who builds relationships with the patient and their families and makes long-lasting connections, and also partakes in the gathering and sharing of vital information to provide effective health care. So in order to do this, we need to have great communication skills, and we also need to ensure that we are meeting the expectations of the patient for the clinical encounter. So in the next couple of minutes, we're just going to view some videos of some patients describing what they expect when they go to their doctor. Keep in mind that we asked them a question, a very broad question, that was what are their expectations when they go see their doctor. We did not ask any other information, and it was very surprising to see what they focused on. So let's take a few minutes there. Thank you.
Hi, my name is Kadeen, and what I expect from my doctor is to be very transparent. I also expect my doctor to make decisions with me and not for me. I really hope that this helps. Thank you.
The expectations I have for my doctor are for my doctor to be caring, compassionate, competent, and respectful. While waiting to see my doctor, I would hope to not have to wait too long, and that the doctor will maintain privacy by keeping my file confidential.
When I go to see the doctor, I like to listen us and view answer easy to understand.
My doctor's appointments, I've come to expect a quick diagnosis. My case is given a fair amount of consideration and is explained to me in a clear and non-condescending manner.
What I like to see when I go into the doctors is, they're empathetic, they listen to my problems, and they don't dismiss me, and they actually explain my symptoms and what's going on.
From my doctor, I would expect, first of all, that he actively listens to me. And a doctor should know about my problem and my stress factors, because sometimes they're very relevant. And also, from my doctor, I expect that he always explains to me what things mean, and that he's always clear and transparent with me.
Let's recap some of the expectations that was mentioned in those videos. So many mentioned that they would like a doctor who is caring, competent, compassionate, knowledgeable. They would also like their doctor to actively listen to them and not dismiss their concerns. And they would like them to show empathy, show concern, and give them fair amount of consideration. They also mentioned that they would like clear explanations and would like someone who is transparent. And another thing that really meant a lot to me was when someone mentioned that they would like the doctor to share in the decision-making process and make the decisions with the patient and not for the patient. And of course, they would like us to maintain confidentiality and privacy as well. So there's a lot of communication skills that was mentioned here, which I would like to go and discuss further in our next video. For now, what I would like you to do is take home the message that communication is very essential, and it's encountered in almost every clinical practice, and it's an intrinsic expectation that patients have from us doctors as well. So we will discuss more about communication skills in our next session. In the meantime, I would like you to reflect on the expectations that was mentioned in those videos, and also reflect on our own experiences in terms of when we encounter a clinical scenario, or when we help a patient or provide care for a patient, versus when we go in for care, when we are the patient, or the roles are reversed. And we'll discuss more about that in detail for our next session. And I would like to thank you for your time and for being here, for listening to me. And I wish you all the best. Have a wonderful day.